Hi, my name is Madison, and for our narrated case assignment, I decided to do the case of Adrian, who has generalized anxiety disorder. I chose this case because I myself have generalized anxiety disorder and felt a personal connection to it. So some of Adrian's symptoms were excessive worry about her children's well-being, and then also making mistakes at work and being fired for these mistakes. For her treatment, she did cognitive therapy, worry exposure, and worry behavior prevention. For Adrian's treatment, she did things like keeping daily records of her thoughts and anxiety symptoms. She would also take about an hour out of her day where she would worry and then examine the validity of her worrisome thoughts. Adrian received 15 sessions of treatment, and at the end of the treatment sessions, she did report feeling decreased levels of worry. For the thinking critically portion of the case, the first question asks, what do you think differentiates normal worry from the worry found in generalized anxiety disorder? Everyone worries from time to time, but the difference between people who have generalized anxiety disorder and people who don't is that people who have generalized anxiety disorder usually can't stop the worry without some sort of help. And according to chapter 5 of our textbook, it says that the DSM-5 criteria specify that at least 6 months of excessive anxiety and worry must be ongoing more days than not. The textbook also states, furthermore, it must be difficult to turn off or control the worry process. This is what distinguishes pathological worrying from the kind we all experience occasionally as we prepare for an upcoming event or challenge. The second question asks, while in treatment, some people with GAD are reluctant to relinquish their worrying and worry behaviors because they believe that these features are helpful to them. Do you believe worry can have adaptive qualities? If so, what are they? What do you believe the negative consequences of worry, especially when the worry is at the level found in GAD, generalized anxiety disorder? I believe that worry does have adaptive qualities when the worry is moderate and serves a purpose. Worry can help individuals anticipate possible problems and plan successfully. For example, if someone had an important presentation coming up, worry might help them prepare very well for it. Although in GAD, worry becomes maladaptive and can have some negative consequences. Some of these consequences include cognitive overload and emotional distress, which I have personally felt myself. The next question asks, says research indicates that unlike many other disorders, GAD has a gradual onset that frequently dates back to childhood. Many adults with GAD recall being tense, anxious, and worried all of their lives. Why do you think this is the case? Do you believe that their tendency to worry excessively is more like an endearing personality characteristic than a symptom that occurs acutely from time to time? I say that yes, I believe the tendency to worry excessively in GAD can sometimes resemble an enduring personality characteristic rather than an acute symptom. A factor that may contribute to this could be cognitive and behavioral patterns and environmental influences. For example, individuals who grow up with an overprotective caregiver may develop worry that is learned from the caregiver as a coping mechanism. For the last question, it asks, in addition to the strategies discussed in Adrian's treatment, what other methods do you think would be helpful in treating persons with GAD? I believe another good treatment for individuals with GAD is medication, although this would not be the treatment that I start somebody off with. If I was to make a treatment plan for somebody, I wouldn't right away start with just giving them medication. I would probably start with how they did Adrian's. I would also start them with cognitive behavioral therapy, another method of treatment that might benefit an individual with GAD is creating some modifications to their lifestyle, like getting regular physical activity and creating consistent sleep schedules, just to keep them on a consistent schedule overall with like the physical activity and whatever. As a person with GAD, I have experienced that when I tend to have a set like schedule or keep myself busy, I tend to worry less, actually. So getting physical activity and getting regular sleep, about 7 to 8 hours a night, is what has helped me personally with my GAD. But yeah, thanks for watching.